Okay, well, in the interest of getting going, I think we'll start, shall we? Hello, everybody. Welcome to the Institute of Health and Social Care Management and our Workforce Wellbeing Special Interest Group. And today we're delighted to welcome a real friend of the Institute, the one and only Derek Mowbray. Derek, I'm going to let you really take over this and do your presentation, and do please leave some time for Q&A at the end. I'm sure people will be interested to ask some questions. Thank you.
Okay, well, thank you, John, and hello, everyone. This presentation has got a lot of slides in it, so I'm going to go through it really very quickly and focus on some key messages. And copies of the slides will then be available afterwards so that you can sort of go back over any of the points that I've been making. I've prepared it in terms of looking at what leaders themselves need to do in terms of dealing with hybrid working, as well as what they should lead other people to do as well. So there's a mixture of the two. So I'm a psychologist, therefore everything to do with well-being is seen from a psychological well-being perspective. Psychological well-being is about your capacity to think clearly and understand what's going on around you without any interference into your cognitive processes. And so in terms of organizations and psychological well-being, organizations need to be constructed in a way which makes the workplace a fabulous and positive place to work. And that is largely down to leaders. So we're going to have a look at hybrid working and leading through it. And these are challenging times, and the sort of questions which are of interest, I think, in this topic are these on the slide now. How on earth can we actually keep control and help and support people who are themselves working remotely from the workplace itself? It extenuates the difference and difficulty of which leaders have in actually performing themselves by persuading people to do things that they might otherwise not want to do without causing any form of distress. And to do that remotely is an added challenge. So there are these matters of concern. I've put herding cats here because of mismatching expectations, largely because when you're remote working as well, your cats are distributed, and it becomes even that much more difficult to bring them together in order to do whatever it is you want to do as an organization. And of course, there's quite a lot of research going on about the impact of hybrid working. This is a recent survey which doesn't show very good results, really. Small amount of employers supporting mental health in the workplace, still seen as a subject which is not gathering that momentum which it needs to do in order to ensure people perform at their peak in the workplace. There is still a long way to go. So the framework for this talk is this one. We've got leaders in the middle and then a variety of subjects to tackle. So my first message is that there should be less management and more leadership. Now, what on earth does this mean? It means these things, basically. Teams need to have a clear identity, particularly if they're working remotely. It's the identity of the team that brings the team together and team members interacting successfully with each other. If they have that identity and clearly know what it is that they're trying to do, and they really want to preserve that identity, then that helps enormously when people are distributed in terms of their working. Leaders need to place their team members as the most important and top priority of each day, and to give control to them without taking it from them. And so that builds up the trust and the interaction which takes place between leaders and followers. But clearly that can only occur if there is a clear direction and everybody has a clear vision as to whatever it is that they're actually about to do. So there's a lot of construction of the team, which happens when they're working in the office anyway, but needs to be reinforced when people are working remotely. And of course, all of this depends on super fantastic communication. So message 2 is that leaders need to help their teams develop their resilience. This is all about turning threats into challenges. Resilience, as you know, is all about making an effort to overcome extremely stressful situations without experiencing any stress themselves. We know that stress has got this strange interpretation as to what it is, but it is something which interferes with the concentration of individuals, and therefore is something which needs to be prevented. And part of the prevention process is to build up resilience. And part of that resilience process is that individuals need to be able to look at challenges in the eye and gives them a wink and overcomes them, leaves the challenges behind and move forward. So the characteristics of a resilient person are these. They need to be able to perceive adverse events as challenges and opportunities and not as threats. So in order to achieve that, then individuals need to have this strong sense of self-belief, self-worth, motivation, and control, which are the pillars of resilience. In psychological speak, it's about self-esteem, self-efficacy, motivation, and control. And when you're dealing with remote working, building up individual self-esteem within the team, it becomes that much more difficult, but it's done by encouragement, constant involvement with the individual, constant contact, allowing them to have control of situations and not taking control, as I've mentioned, and also ensuring people are developing the skills, are able to come back to the leader and talk to the leader if things are not going well. And the sort of behaviors which leaders need to have are these, the intelligent behaviors, the most important of which is, of course, attentiveness. Attentiveness works when you feel that someone is being attentive to you, and try and ensure that happens with remote working is a major skill which leaders need to be able to develop. And then all of the other intelligent behaviors need to be applied by each leader of each team. But they need to be able to stand for something, or they'll fall for anything. So teams need to develop this incredible identity and consolidation of some fundamental aspects of team working in order to survive remotely. And these are the aspects which need to be developed. Clear purpose, expressed in outcome terms, because in outcome terms we know what the impact of the team has on followers, for example. Exactly the same needs to be developed in terms of the long-term vision. If there is a long-term vision, that adds to people's belief and consolidation of their attachment to the team, because they know the team's in business for a long period of time, it's got an idea about the future, so their engagement is enhanced. And then these three different elements of value, all of which need to be repeatedly reinforced by remote working and communication. Message 3. Some people find remote working easier than others. Surprise, surprise. And therefore, under these circumstances, we need to be aware that there are certain groups of people who do find things more difficult. And some people, of course, find it easy. So 60 to 75% of the population generally are extroverts and therefore find social interaction a really important aspect of gaining their energy. So remote working is really quite challenging to them, and we need to understand that. Conversely, people who like to plan and have structured existence, for example, may find remote working easier than others. And so we need to understand the preferences of our own teams in order to understand who's going to find it easier and more difficult. Message 4, leaders need to take control of remote working. How are they going to do it? Well, you need to go through certain actions which are important, and I've selected 4 of these. Hybrid arrangements need to be quite clear in terms of how best to operate a team. Is it clear as to how people should be interacting with each other? Are there clusters working physically together that actually need to be more closely related in terms of their hybrid working? And how frequently do individuals need to cluster together in order to achieve either social interaction or bouncing off ideas of each other and so on? These things need to be established and not taken as a sort of accepted process for everyone. Team members are different, and we need to understand how they interact with each other in order to get the best out of them. We need to ensure flexibility. People need to be fluid in terms of what they're doing in order to be able to work remotely. Remote working really is the opportunity to enhance flexibility. And so there should be no really prescribed way in which people should come into the office and work at home. I know that there is a great tendency to try and prescribe people coming in on alternative days or whatever it is, but it needs to be established with the team itself as to how that can be effective or not. Structure. Here are some ideas about structure. People do need to work out their 168, and if you don't know what that means, that's about the hours in a week. And everybody needs to understand how the hours are allocated in order to successfully determine their work patterns and so on. And I always suggest that you you establish your normal working day along the lines of what you were doing in an office. You also need to establish how much time you're going to spend doing productive work. And that means producing outputs, which are not meetings. There's a great tendency to spend a lot of time actually engaged in conversation rather than producing results. And so a leader needs to help teams establish how much time is going to be spent genuinely producing work and to protect that time. And there are other aspects that need to be done in terms of structure. In terms of interaction, we need to establish mutual expectations between different members in the team itself. And set priorities, work out which is important, which is urgent, and so on. And tasks that need to be completed. I always suggest, wherever you're working, to try and put yourself under pressure for 50 minutes in an hour so that you're able to concentrate and be able to be productive in that moment or in that period of time. As long as after that 50 minutes, you have 10 minutes where the brain recovers and does something completely different. When you're working remotely, shutting off all the distractions is an important aspect of remote working, as well as being in the office. That's at all possible, in order for yourself to be placed under personal pressure, because that aids your concentration. And that's why you need a 10-minute break at the end in order for the brain to do something else, like have a coffee or become depressed by looking at emails and so on. And there are other tasks that can be done in order to maintain this ability to have a structured day. Message 5, take control of your own psychological well-being. There are various ways of knowing how you're feeling throughout the day. And this is just one of them, by asking yourself at different times of the day how you're feeling. Are you on top form or something else, in order just to keep an understanding as to what's going on. In order to help with your psychological well-being, these are some of the features which are important. Interaction is absolutely critical as well. So we need to ensure that we maintain a good relationship between team members, and also undertake some of these other aspects, that even if you're having hybrid working, have some virtual lunch groups together in order to ensure that everybody in the team is interacting effectively with each other. And there are also some tasks to be done. Some of these are easier to explain in person than they are remotely. But for example, being playful, having humor, interacting in a humorous sort of way is also part of the process of feeling well. Doing mindfulness exercises, I'm sure you've been told a lot about that and what to do. And at the end of the day, write down your successes that have occurred and build on those, because those are the things that make us feel well. We also need to take control of our physical well-being. And the task for doing that at home or in whatever remote situation one has to be, happen to be working, is to find the suitable space within which concentration can take place. I, for example, have a standing desk. I'm actually standing at it now, and that's helping my physical activities as well. Having a posture which is right, doing exercise. I suggest people dancing. It may sound strange to do that, but actually it's great fun if you can do that. And of course, having attention towards such things as nutrition and hydration throughout the day, all of which helps the physical aspects of our well-being, which themselves then help our psychological aspects. Message 7 is take control of working effectively with others. Remembering that each team member is going to be remote, they need to be able to communicate with each other. And some of the aspects which are important here are finding the reliable platform for conference calling. There are so many on the market these days, and some are better than others, some are much more flexible than others. One needs to be able to understand how to use them as well in terms of their different capacities and so on. And we as an organization, MAS, put on training programs for teaching people how to use different platforms and so on in order to get the best out of them. Working out when to communicate, working out whether in fact having a WhatsApp group is a good thing for a team to have. Generally speaking, it probably is. Establishing mutual expectations between each member and so on. And of course, this business of communication all the time. And message 8, take control of yourself. Self-discipline. What do you need to do in order to be on top of your game? Getting up earlier than normal, developing the structure of the day, having some sort of format which is useful, and making decisions throughout the day as to what in fact you're going to be achieving by the time you've finished the work throughout the day. And turning off social media, very easy for people to become engaged with that when they're hybrid working and no one's watching them, as it were. Using your calendar on your computer in order to ensure that key tasks are completed. Really important in order to have a structure. Otherwise, days can quite easily drift. And then there is the tendency for leaders to come in and want to know what's happening all the time, which of course isn't going to be helpful for psychological well-being. So some of the final things to think about in terms of hybrid working as well as psychological well-being generally. Always think and believe that you're a fabulous human being, because you are. Always think and believe you can achieve the big things in life. Keep an open mind. Try and stay tranquil and calm when hybrid working as well as in the office, and always be attentive to other people. So that was a rush through a fairly substantial number of slides, but the slides will be available to you after this session. But I'm open to any questions now and exploring any of these aspects that I've been talking about, and maybe explore them in more detail.
Thank you, Derek. Well, there you are, folks. An open invitation from Mr. Derek Mowbray. If anybody would like to ask any clarification questions, or maybe even just bring up a topic that for some inexplicable reason Derek didn't cover, who'd like to ask any questions at all, do please shout up. Now is your chance.
Thank you very much, John and Derek. Thank you very much for a lovely overview. They're very detailed and great pointers. I was wondering if I may pick up on the piece around flexibility regarding prescribing, because I get a feeling now, and from own personal experiences, that we're transitioning, coming back, so that hybrid working, but there's perhaps there around prescribing where, for example, as you mentioned, there's a requirement for people to be in the office X number of days. And I just wonder how you would manage that, manage people's expectations and really offer that flexibility.
Yeah, well, one needs to take account of some of the other things I was talking about as well, in terms of whether people need to be clustered together in order to work together, because I think that's critical. I think the other thing is, why come into an office? You know, we've lived with offices for so many centuries. We take it for granted, but why? Why bring people back in? And there are two reasons that I think are important. One is education and training, to bring people to do that together, because that's much more effective than it is remotely, although it's easier remotely, but it's not as effective. And the second is for social reasons, to bring people together, to socially interact, to chat, because we are social animals and we don't want people to be remote and isolated. But in terms of prescribing when people should come in or not, that is dependent on the job and the clustering of the groups within a team as to whether they actually need to come in and bounce ideas and so on, and how frequently do you need to do that, and to then agree with the team when it's best to come together, rather than just saying come in on Tuesdays and Thursdays and that's it. That is over control. I think you've got to really work from the ground upwards in order to find a satisfactory solution to that. And of course, there are other social aspects of things like commuting and so on, but they will come out in the conversation. It's finding the purpose for coming together, which is really important.
Brilliant. Thank you
If I
so
may,
much.
Derek, and just to add, if I can, from my perspective, Anita, I think imposing is not the way to do this. I think this is about shared opinions, giving people the opportunity to speak up and say what they think and feel, as you would do in an ordinary office environment. You know, I think, you know, I know of some instances, even from, you know, members of the Institute, where they haven't done that terribly well during COVID and when this hybrid working approach began, and they're now finding that actually engagement with their processes and so on are not as they would choose, but they've kind of already boxed themselves into a bit of a corner by insisting that this or that is the way this is going to be done. I don't think it's too late, by the way, but I think a collaborative approach where you seek opinions and you genuinely bring some processes for working together based on consensus. I think that's a far more powerful way of doing this rather than a bulking position, basically.
Yes, and I think the principle, if my leadership program is based on the premise that the combined intelligence of the workforce is far greater than the leaders, and therefore, just to follow up from John, it's the intelligence of the team which will solve that problem. But you've got to bring that intelligence out.
All right, so now I'm going to come to Oluwatosin-Loba, a very committed member of the Institute. She's been on loads of things recently. Oluwatosin-Loba, over to you. You're welcome to ask Derek a question.
Thank you. Thank you so much. And thank you, Derek. I think you've said it all. I really, really enjoyed the speech and everything. And I totally agree with you with having a good rapport with colleagues and also having a good sense of humor. You know, something happened. I work from home remotely. I work with the NHS England. And I had two colleagues call me yesterday and they said, please, can I ring you? I said, yes, ring me. And one of them said, I'm just tired. I need someone to talk to. And while I was chatting with the colleague and I was saying funny things, and she was just laughing all through. And the next thing she just told me, she said, I feel a lot better now. I'll ring you later. So that was really, really nice. I totally agree with everything. But I have a personal question. And my question is, because I work remotely Monday to Friday, after work on Friday, I hardly step out of my house, only when I go to pick the kids in the afternoon from school. And I use my break time for that. When I come back and I continue work, I close 5 p.m. at times 6 p.m. When I log out from my work laptop, I go to my personal laptop and I'm studying, maybe doing a course or something like that. And I don't get to do anything till I go to bed, maybe around 11 or past 11 in the night. And I said to myself, I need to do more because my physical health and well-being is quite very, very important. And if I'm home from Monday to Friday and I don't do anything about it, I don't think that is good for my health and also my heart. So how would you advise me, or what would you say to me? What do you think I can consciously do to also help myself in that area, please? Thank you.
Well, I think the first thing to really try and establish is how much work do you actually want to do productively each day, because it isn't going to be the 9 to 5 that or sitting in front of a computer, because none of us manage to concentrate longer than, I say, about 50 minutes in the hour. And in order to be productive, we need to be quite clear that we're going to achieve something during the day, and deciding what that something is, and then working out how much time that's going to take is the first step. Because the rest of the time, you can then start to look and focus more on your physical health activities, like walking around, like actually having lunch with friends and so on, as though you were in an office and you were able to go out and socialize and so on. You have to construct your own networks, of course, to be able to do that. But the key thing is to work out how much productive work is actually going to occur in the day, because it's not, it says here my internet connection is unstable. I hope you can still hear me, but it's not. It's not going to be the 9 to 5 sitting there producing the results and so on.
Although what a sin low, but let me tell you, I'm not proud to say this, but it's just a fact. I can tell you, I've put on 3/4 of a stone in the last 2 years, something like that, simply because of physical inaction caused by sitting here in front of a screen and just doing what I do every day and caring about what I do enough that actually I don't feel able to step away from it, because it's slightly embarrassing because Jade is here, but you know, we have employees who we have to look after, and we do that by making sure that we do a great job of, you know, for our members and so on, and collecting our fees and that kind of stuff. And I just took a decision a few weeks ago. I think a lot of it's in here. You just decide, right, I'm going to get up early every day for the next week, and I'm going to go to the gym for 45 minutes, 50 minutes, an hour, from 7 till 7:45 in the morning. And do you know what? I started doing that 6 months ago, something like that. And the weight has fallen away, and I feel tons better, you know, and it's not even impacting on my work thing. I appreciate people who've got small children. That may be very challenging. But I think it's a decision you just have to make. And once you've made that decision, you'll feel better straight away, just having made a personal mental commitment to actually do something. And then doing it is, you know, relatively straightforward once you've done that. But you just got to mentally, you break that cycle, and you say to yourself, the single most important thing in my life is my life.
True.
I'm going to do something about it.
Thank you so much. True, conscious effort. Thank you.
Yeah. Julie, you've got your hand up.
Right, unmuted. Yes. No, I think a lot of people are in that same position, aren't they? I know that some days, yesterday was complete madness. I had back-to-back meetings for most of the day, and apart from running out to the loo and back again, that was about it. So, let alone leave the house. Yeah. Anyway, what I wanted to ask is, we've got a big meeting with our team next week, and kind of following up and talking about the staff survey, and because one of our lower scores was people feel a strong personal attachment to the team. So we're kind of want to have a discussion with them and unpack that and what that means. Are there any questions that you could suggest that would perhaps open up that discussion if they were kind of struggling to articulate it?
Well, I have a sort of mini 360-degree thing, which is a good opener for that sort of conversation. I wonder if I can find it. You just have to bear with me for a few minutes whilst I try and see whether I can find it or not. But I think in terms of attachment and so on, it is about purpose at the end of the day, and whether individual purpose matches the purpose of the team, and expressing purpose in outcome terms is really important in terms of, because that reflects productivity of what you're actually doing and the impact that you're doing on other people. It's not a process, it's an outcome. So in terms of trying to get people's attachment to go to that, they need to be very much engaged with that purpose. Then it's all about the values of the team, and whether the team values in terms of their social values, that's the way in which the organization and the team itself values its work, how it should work, you know, when it should work, how people should interact with each other and so on. That's one set. Another set is the priorities of the team, whether everybody's individual priorities are aligned with the team's priorities, and are the team's priorities recognizable as being those that individuals really like or not. For example, The exercise we do on that, it tends to be our customers, clients, the most important thing for the team to serve, or is it stakeholders, or is it the budget holder, or is it the workforce, for example? And people have got to try and work out which is the most important priority from the team's point of view. And if they haven't got the team at the top, then they tend to get chastised for me, because that's the most important thing for the team, is the team. Otherwise, everything else falls apart. And then the third lot of values are all about the ethical standards of the team and whether they match the individual standards that individuals have, and so on. So those are the sort of kicking off questions. Perhaps you could try, but come back to purpose. You know, are we happy with what we're doing? Do we understand what we're doing? Is it clear? And then once that's sort of sorted out, then I think you will find people become much more attached to the team.
Okay, thank you.
Thank you, Julie. Lovely to have you with us, as always. Anybody else? Can we just take a poll? Do you feel, based on your experiences over the last 3 years, do you feel happier in your work and the way you do it now than you did 3 years ago, based on the way you worked? So all those in favour of yes, just put a little hand up saying yes, you're happier now. And if it's a no, you can do your reaction now. So I think most of you, those of you who've done the exercise, it's a no by the looks of things. So you're less happy now in terms of the way that we're working than you were 3 years ago. That's interesting. I know it's only a little poll, but yeah, I think that's probably reasonable. I think we've kind of been obliged to work this way, and I'm not sure we kind of got our heads around that just yet. But there we are. Well, look, Derek, thanks a million once again. We really appreciate you taking the time and trouble to come and speak to the group and sharing some of your ideas. What's your feeling about what will happen in respect of how we all now work? How do you think this will evolve over the next 3, 4, 5 years, do you think?
Well, I mean, technology has advanced at such a huge rate that my suspicion is that remote working is quite clearly here to stay. But it's got all of its problems because it's federating offices, basically. So instead of having one office, you're going to have 20, 30 offices all over the place. And that has created all sorts of problems. But it's here to stay. And I think as we develop more and more techniques for understanding how to interact effectively remotely, then it'll get better over time. But as I say, 60 to 75% of the population are extroverts and find remote working really quite challenging. And never mind the physical constraints, people with children and in particular is particularly difficult and so on. And unless and until we improve the way in which leaders lead, of course, it's all going to be a bit of a challenge anyway. So the technology will develop and the opportunities will develop. But if we don't tackle the fundamental problem of actually having leaders instead of having managers around the place, then we will continue to have real difficulties, I think.
Thank you, Derek. Take any final comment from anybody? Okay, well, look, once again, thanks to Derek. What is it? It's 20 to 2. Do you want to use 20 minutes to discuss next activities of the group and some ideas for later in the year? I'd like to use just 5 minutes first, But then if we want to finish early today, we can finish early. Or if we want to discuss some more stuff, we can discuss some more stuff. But here's the conundrum. I think workforce well-being went through a kind of a halcyon period during COVID, where there was a huge amount of attention on it, quite rightly and understandably, because of the stresses and strains that the health and care workforce were placed under. But I really feel that the temperature on that has been turned down. I don't feel that well-being is particularly being spoken about in the same urgent manner that it was maybe 2 years ago, something of that nature. And I think perhaps we need to reflect on how do we push it back up again. So if you look at things like the recent industrial action that's taken place and the consequence of that for many of you who'll be on this call today, I know from testimony that I've heard from various of our members just how challenging it's been to reorganize and reconfigure services and plan for days of industrial action and you know, work with consultants and nursing staff during the JDs to make sure that actually we can offer a safe standard of care and so on. I know how challenging that has been. And for a few of you, that will be the second or third time now that you've been obliged to do this kind of planning and behind the scenes work activity. But nobody's talking, as far as I can tell, in the halcyon halls of power about the effect that this kind of urgent, non-standard, sudden requirement for working is having on just operational managers. Never mind, you know, those people who are coming out on strike and so on. You know, the effect that it's having on those who are obliged to cope whilst these strikes are going on is not really being spoken about. You're just kind of expected to do it and come through it. And I've seen at first hand, I've seen, you know, members of the Institute who've spoken to me about this, and you can see in their eyes just how challenging this period of time has been. It's got nothing to do with COVID. It's got nothing to do with wait lists. It's got nothing to do with money. This is just to do with they're being asked to do an extraordinary job now for quite an extended period of time, or maybe the third or fourth time they've been required to do it. And nobody's talking really about their well-being and welfare. And I just wondered whether anybody might like to comment on that, whether there's something the Institute can do in that regard. You know, I regularly write in my column on a Friday to say thank you and, you know, reflect the hard work that is going on there. But I wonder whether that's enough. I just think the management community, it's just been kind of taken for granted that we'll find a way to make it all happen. Any observations, anybody?
I suppose, I mean, my observation is based on the I think the fact that the leader development, not just in the NHS, so it's there, but right across all of the industries that I deal with, is, if I put it in terms of the mantra that we promote, is that it is the role of leaders to guarantee the workforce, the perfect working order of the workforce, knows where it's going and knows how to get there. But it's the perfect working order that comes first, before almost anything else. And to get that into leaders' minds, because unless that is implanted in leaders' minds, then the workforce is always left to the last, because most leaders are technical, don't necessarily understand how to lead people because they've been technical in their management activities and everything else, and are not adaptive enough to be able to understand how to look after people, not necessarily interested in that. Certainly isn't the expectation placed on them by the hierarchy of different organizations, whatever they happen to be. which is always looking at process. But to actually get the mantra into the leaders, that it's their job to ensure the perfect working order of the workforce.
No, they can't, Eric. They can't at the moment.
No,
this is a situation that confront, and I'm not talking CEO level. I'm talking way down from there. Supervisory grade, what we might call junior management, and so on. Just people trying to, for example, plan the rota for a chemotherapy clinic and so on, and they look knackered at the moment.
Yeah.
It's nothing to do with them. They've repeatedly been required to work, completely contrary to what their agreed contract might be, to try to just deliver some kind of a service while a whole load of junior doctors are off on strike, or a whole load of nurses are off on strike, and you're just trying to keep your patients as safe as you possibly can. This is above and beyond, and they see the effect that it's having on patients. They're the people that take the telephone calls and receive the letters and the emails from patients that have had treatment delayed or cancelled or postponed or whatever. And that's very challenging circumstance at the moment, and it's not being spoken about in mainstream in respect of well-being.
No. But it'll come out in the data, won't it? I mean,
well, it will, because these people will leave. They'll go and find something else.
Well, that's exactly. I mean, we're already a decade too late in dealing with all of this. I mean, you were right in saying well-being has fallen off the agenda. We were talking before I started the talk about the fact that, in my world, people are not picking up and not wanting the sort of support and help that they used to require and so on. Because the pressures of the world are just too great. It's got to the tipping point and it's gone over. Retrieving it is going to be extremely difficult.
Well, that's when we're going to need some love and support and understanding and nurture, I think. And I know this group will work at that. Well, I just wanted to bring it up because it's something that it's been kind of on my mind for a little while. And I get the letters and the emails and the phone calls from our members, talking about this and saying, I don't know what to do. There's a horrible thing to say. There's a kind of hopelessness beginning to creep in, which is very damaging for people. Well, all right, I just wanted to bring it up with the group. It may be something that we return to in one of the subsequent meetings. We'll have a look at this. Maybe we should accumulate some lived work experiences from our members about what it's meant to them when these strikes, for example, have been taking place, and in the planning run up to these strikes, just what they've had to endure, because it's not been spoken about.
Yeah, I think that's a good idea.
We might look at that. We might well look at that. What do you think, team? Should we do that?
Yeah.
Do a little survey of our members just to ask them to provide some testimony, lived experience, worked experience during what's been going on. I think that would be very interesting.
I think it'd be interesting to hear people's voice, because you don't get that represented anywhere, do you? You've got the people that are striking in their view, you get the government's view, whatever, but there's nothing about, and you obviously get patients being angry about
nothing about, but there's nothing about the poor buggers left to pick up the pieces. Absolutely. In the workplace. There's just an expectation. Well, they'll find a way, because they always do, and we do. You're brilliant at what you do, but there's an elasticity to this, and I think it's reached the point where it's going to go snap.
Well, I think it's gone snap, hasn't it?
Well, hopefully not universally anyway. Look, it's been great to see you all. Thank you. And we'll do this testimonial gathering. Jade's made a note. I think we'll have a look at that. We'll set up a survey monkey and see if we can collect some response. I might write about it in my editorial next week, and we'll see if that can just catalyze it a bit. But for the rest of you, thank you so much for tuning in today. Great to see you. I think Anita's just trying to come back in. It's great to see you. Do please have a super duper weekend. I don't know what happened to this. We were supposed to have a fortnight of super duper weather, where all of our tomato plants and everything was just going to come. And looking out of my window now, goodness me, very disappointing, folks. So you gardeners out there, stick with it. You know, we will prevail. Those French beans will come up in the end, I promise. All right, folks, mind how you go. Thank you, Derek, once again for your input today. Really appreciate it.